Welcome back to Can You Hear Me, a podcast about hearing, hearing loss, and everything in between. I'm here today with Dr. Emma Durazzo, audiologist and founder of Anywhere Audiology. Dr. Durazzo, thank you so much for joining me today.
Yes, thank you for having me. It's an exciting opportunity.
Yeah, and I'm, of course, excited too. So we'll just get straight into the interview. My first question for you is, can you just tell me a little bit about Anywhere Audiology? Why did you start it, and how did your background really influence you in starting it?
Yeah, so Anywhere Audiology is an in-home audiology practice. We cover New York, New Jersey, a little bit of Connecticut, a little bit of Pennsylvania. And so we do everything in our patients' homes, whether that's private home, a community, a hospital, anywhere our patients are, we go, not to be punny. So we've been doing this for almost 6 years. It's 5.5 at this point. We'll be 6 in December. So I started the practice alongside my husband, Michael, about 5.5 years ago. We, in height of COVID, kind of just trying to figure things out for ourselves. My husband has a background of working in sales. And so that industry itself was kind of up in the air in the height of COVID. So we kind of decided to align forces and kind of go for something ourselves and create an in-home audiology practice. So using my experience working at Cornell for a long period of time, good clinical skills, so I like to say about myself, and then combine that with his sales background. And, together we've been able to, establish a practice and a name for ourselves. And so that's been pretty exciting to do together.
Yeah. I mean, this definitely seems like a really cool initiative you've started. And I don't think I've heard of anything where the audiologist is going to a patient's home and treating them. So, how is this really different than the previous kinds of audiology clinics we see? Why is this needed in today's world? And could you tell me a little bit about some of the difficulties you faced in starting something like this? I
Yeah.
mean, I know this is pretty non-traditional, so how is this that much different from, let's say the traditional audiology clinic?
Yeah, so I guess I missed a whole part of my answer. So, in height of COVID times, people were, a lot of people were coming in saying, it's scary to come out, or it's been difficult to get out. And I think that kind of just rose a new awareness to me that, people didn't have the access that we thought they did. And even before COVID, I'm sure every audiologist has heard, I wish I could take you home with me. I wish you could, come sit on my couch and hear my TV or my, conversation across my dining room table. And so it was always kind of a thought in the back of my mind that it is something that definitely can be done. Well, maybe not at that time technology wise, but, it would be nice to bring that to the real environment, because a lot of times, any audiologist hears their patients say, well, they sound great here in your office, and then I go home and X, Y, and Z. I can't hear my husband. I can't hear the TV. I can't hear my grandkids. And that's frustrating. And as a provider, it's really hard to break that barrier of, I can do so much in the office. I can make these changes. Maybe you'll have to come back. We'll make more changes. So now I have the experience of being in that environment, helping them with their TV, making sure they can hear all those important sounds around them. So I think it breaks down a big barrier just for the traditional patient. In addition, we also have a lot of patients that are homebound, so they don't really have an alternative or a means to get out in a lot of cases. So the families, a lot of our patients' families will say to us that, they've just kind of been living with this and it's been frustrating, and they've been yelling, and their loved one is just kind of isolating and, getting upset regularly because they're being yelled at. So it's given us an opportunity to access those patients as well. So it's, getting us in that real everyday environment, and also opening up care to people who may not have had it otherwise.
Yeah, that's awesome. So you talked now about what you've done, you said in the last 6 years with Anywhere Audiology, and I read that you initially started it as just yourself, and now you have two other audiologists that practice alongside of you,
Yeah.
which is awesome.
Mhm.
And I really want to know, where do you hope to take Anywhere Audiology? What are your goals for this company?
Yeah. So, I mean, dream goal, I guess, would be to be kind of synonymous with mobile audiology, that anywhere and they go anywhere. So obviously they're the mobile audiologist. So yeah, I mean, we're always open to opportunities, expanding. Maybe that's nationwide. Maybe it's, just the Northeast. I can't tell the future. But, definitely open to opportunities to expand our practice, expand our reach. I know that mobile audiology is growing. So whether that's something that's happening that we're a part of, or that it's just growing in general, I'm happy to see more people get access. But I guess selfishly, or as a practice owner, it would be nice to be part of kind of a mobile audiology initiative of it really becoming a standard option for people nationwide. I think that would be great.
Yes, yes, I see what you're saying. And maybe something you can focus on in the future is your daughter programs, which is something I saw on your website. And what I mean by that is I saw something about Neuralisten and I think it was Auk hearing.
Yeah.
So can you tell me a little bit about those? I mean, are those like spin-offs of Anywhere Audiology? What do those focus on?
Yeah. So from the beginning, we were really open to any, kind of space in audiology, whether it was hearing aids, auditory processing, kind of the occupational space, industrial hearing. So over the years, we've kind of dabbled in all those things. And so more recently, we're being more intentional about the work that we're doing in those other spaces. So Anywhere Audiology is our umbrella, slash our, traditional audiology things. And then Neuralisten is our auditory processing program, which is done through telehealth. So aligns well with our, extending reach, expanding access for people. We do that in New York, New Jersey, Connecticut, Pennsylvania, and Florida at the moment. So it's a nice opportunity for people to have access to auditory processing testing and training. So that is our newer brand, so to speak. And then Auk Hearing is our occupational hearing testing program, where we go out to industrial sites and do hearing screenings for them. The nice thing for us there is that it has the audiologist touch. A lot of the big chains that do occupational testing are a lot of technicians run it. So for us to have a direct hand in that testing and management of their hearing safety is really cool, kind of different perspective on audiology.
Yes, I can definitely see where, these things are important. And I do hope to see more of this mobile audiology stuff in the future because I definitely think it is really expanding the reach of audiology in general, which is really what the field needs right now. So,
Yeah,
you know, thank you so much for joining me today, Dr. Durazzo. I am really excited to see where the Anywhere Audiology family goes in the future.
thank
And
you.
it's been great having you on the podcast.
Yes, thank you for having me, and thank you for the well wishes.